But just to start, my name is Noah Lenstra, and I'm speaking to you from Greensboro, North Carolina. And I'm joined with my colleague and graduate research assistant, Joanna Roberts, who will say a little bit about the methods that we used in this project in a few minutes. But I also want to start by just making an acknowledgement that this project would not be possible without the South Carolina Center for Rural and Primary Healthcare, as well as the South Carolina State Library. And Wendy Roberts from the State Library has been just enormously generous in her time in terms of making this possible. She did have a conflict today, but I just want to make sure that we acknowledge Wendy from the State Library and her contributions to this effort. But today we're talking about public librarians as health partners, evidence of needs and opportunities from a statewide survey. And just a roadmap of what we'll cover. So we'll just start with very, very briefly, just skimming the surface in terms of public libraries and health. How did these two come to be framed together before we then look at public librarians as health partners in the present. We'll then go right into our survey, what we tried to collect, what we did collect, and what we learned about the different ways that South Carolina's public libraries are supporting health. What do librarians and library workers feel like they need, and what do they want, and what sort of relationships do the workers of South Carolina's public libraries have with folks in the health sector, and what can we do ultimately to bring our public library workforce and our health workforces closer together. And so just to kind of kick things off, and thanks to folks who have already introduced yourself, but I want to say this is really an unprecedented opportunity for health and library people to get together. And so let's take advantage of that. If you wouldn't mind just in the chat, briefly introducing yourself. And thanks to Ashley and Donna and Alonti and Megan for doing so. I know some of you introduced yourselves before the webinar began, but we'd love it if you could introduce yourself again, because like I said, this is really in my opinion, in my experience, an unprecedented opportunity. There's not too many gatherings at the state level that bring together folks from both health and libraries. So let's really take advantage of this opportunity. And I would not be angry at all if you all have your own kind of sidebar conversations in the chat while I'm talking. This is really your time to network. So feel free as I'm talking to use the chat function to talk amongst yourselves and introduce yourselves as much as you'd like to. And we will have time for question and answer and discussion at the end. And I want to thank my graduate assistant, Joanna Roberts, again for keeping an eye on the chat. Feel free at any point to put things in the chat, and we will make sure to come back to it towards the end of the webinar today. And for now, let's just jump right in. So as folks know, today is National Library Outreach Day, which is part of National Library Week. And also this is National Public Health Week. So I think it's the perfect time for folks in health to be talking together and getting to know each other. Librarians do a lot of their work outside of the library building, including online. In forums like this one. So I think it's just a perfect setting for this conversation. But just taking things back a little bit, I want to really articulate and make clear that the idea of libraries as health partners is not a new idea. And in fact, you can find examples going back to the genesis of public libraries in the mid-19th century. I think there's always been kind of creative local partnerships that seek to influence public health through innovative partnerships. And this is just one example I always love to share from Northeast Georgia from the late 1940s when this rural library system partnered with the county nurse to bring the nurse on the bookmobiles round. So as rural residents of Georgia went to meet the bookmobile to get books and return books, they could also access pamphlets and information on maternity health and even get primary health screenings thanks to this unique partnership. And we've seen these
He just needs to open up the damn
just hearing some
he just needs to open up the quote. It's $252
let me see if I can
total.
figure out. Sorry about this. We're getting some audio feedback.
Man,
give me 1 second here. I think sorry about that. But let me just talk about some of the ways that public librarians can help communities, because I think we all know when we think about libraries, we think about, of course, reading and the transformative potential of reading. And of course, that's absolutely what public librarians do, but it's not the only thing. We also exist to ensure equitable access to not only information, but evidence-based information. So we exist to support access to useful and timely information. And we also exist to support public space and the community building capacity of public space. We're one of the few institutions across South Carolina and really across the country where folks of all backgrounds can come together to learn and to get to know each other. And if you'd like to learn more about these 3 pillars of public librarianship, this is a book I would certainly recommend. Wayne Wiegand's Part of Our Lives, A People's History of the American Public Library, published by Oxford University Press a few years ago. But what I find to be really interesting is that even though there is this hidden history of health library partnerships, it's really come into focus at the national level during the last 10 years. And one of the ways it's come into focus is around food security and learning about food. I'm sure folks in public libraries know about the South Carolina State Library's really great Read, Eat, Grow initiative focused on Charlie Card and basic culinary literacy, but that's really part of a national trend to, especially for children and youth, connect food access and food literacy and basic nutrition information to libraries. And a great example of this is this webinar led by the USDA in partnership with the Institute of Museum and Library Services in 2014 on how libraries can get involved in summer meals. Another way that this topic really came into national focus was with the Affordable Care Act. With kind of the rollout of the ACA, there was an enormous impetus to have public libraries really help people navigate and sign up for health insurance on the ACA marketplace. That led to projects like Web Junctions, Health Happens in Libraries, which had an initial focus on helping librarians get ready for the Affordable Care Act, as well as publications like this one. And this momentum has really continued with publications like Libraries, Public Health work together on community health, published in The Nation's Health, the official magazine of the American Public Health Association. Actually the 4th most read story. And what I think is really important is that this recent attention has really highlighted that libraries can support community health in a variety of different ways. Not only a blood pressure check, a place to get out of the elements, but as this photo here shows, a space for yoga classes. So the wide variety of ways in which local libraries can get involved in health promotion. And we're really seeing, just want to make a quick, over the last 5 years, we've seen a real strong emerging infrastructure around social work in the library. And I really want to make a shout out to the director of the social work program and my colleague here at the University of North Carolina, Beth Waller. She's actually a national leader on this topic. So obviously Charlotte is not too far from y'all in South Carolina. So I think Beth would love love to hear from you, and you can see her email down below, beth.waller@, swinthelibrary.com. But really doing phenomenal work on this stuff. But social work is not the only hot topic when we talk about health promotion in libraries currently. There's been a lot of focus on telehealth, on COVID-19 related services, social workers, food security, and combating misinformation.
Helpful, do you think? Okay.
Oh, sorry about that.
Yeah, hopefully.
And
not
just
that
a
way.
reminder, we're getting some feedback. If folks could please keep their mics muted. And let's see if we can. Sorry about this. And so just to kind of, I want to just introduce myself. So as a researcher here at Greensboro, my focus is really to step back from whatever trending hot topics may be the flavor of the day to more fundamentally understand what it means for public libraries and public librarians to be part of community health. And I think this more fundamental understanding is needed because I think what often happens is that the public librarians kind of get yoked in at the 11th hour to whatever the trending hot topic is. And that's fine as far as it goes, but it doesn't really lead to the creation of the infrastructure that I think we need to more fundamentally support public libraries and public librarians as part of our nation's public health infrastructure. And this is really important because we know from publications like the National Association of City and County Health Organizations, National Profile of Local Health Departments done every 3 years, that libraries are the least utilized community-based partner of local health departments behind all the other sectors asked about. And so to kind of, before we get into our South Carolina study, just really briefly want to talk about a couple of projects that I've done over the last couple of years, really looking at trying to understand how public libraries are part of local health infrastructure. So I've done 2 projects in which we interviewed both public librarians as well as the health partners that they work with to understand how local librarians are getting involved in community health, what stands in the way, what facilitates this work. And what we've really found through these interviews and talking with over 70 individuals in the health sector who've worked with public librarians across the country is that as these relationships between health folks and library folks develop, there's really a shift in thinking in terms of how people in the health sector see public libraries. Before there's a relationship in place, folks in the health sector often see libraries as merely book repositories, as spaces that distribute books and maybe have a story time, maybe have a book club, but it's really all about books. And again, nothing wrong with books. I love books. I read all the time. I wouldn't be in libraries if I didn't love books, but libraries are so much more than that. And over the course of getting to learn a little bit more about libraries and what librarians do, folks in the health sector often begin to see that the library is a trusted resource at the heart of communities. The library is always there. It has a lot of trust embedded in it. It has a lot of stability. And as a result of that, people in the health sector will often see the library as a space to use for food distribution, telehealth, access to social workers, access to community health workers. But what I find really interesting is that in these interviews that I did with health partners, over time, often there's a shift from the library as kind of a passive space to get things out to more librarians as active partners in communities. The idea of public librarians as partners that we can work with to figure out what to do. So rather than come to libraries with fixed ideas about what we want to do in them, we instead approach this as a relationship that has mutuality community in which we can work out together what we're going to do to make our communities healthier places. And this comes out really vividly in the way that partnerships evolve. And I'll just quickly share one very short example. So I did an interview with the local health department in Bethlehem, Pennsylvania, and their partnership actually began with the idea of let's have a public health nurse in the public library to provide some rudimentary screenings and referrals for individuals experiencing homelessness. And based on that initial partnership, things took off in all kinds of directions. It led to having subsidized food distribution where low-income families and individuals could pick up food boxes from the library and have a nutritionist at the library to provide basic instruction and how to prepare and serve said food. It led to a bike share where individuals could check out bicycles from the library, and it led to story walks throughout the city in which libraries were posting stories with the support of the public health department to promote physical activity. And those types of things only happen when librarians are at the table, when we're really building and forming relationships that are kind of go in unexpected directions. And just how do things look in South Carolina? Not bad. There's been some really great research recently out of the University of South Carolina, and I want to really highlight Carrie Draper and Ashley Page from the Arnold School of Public Health, which is a SNAP-Ed implementing agency. They've done some great work on the feasibility of partnerships between public libraries and the SNAP-Ed program. And a student in the Arnold School of Public Health actually did a dissertation on the organizational capacity of public libraries that offer obesity prevention programs. And there's been some great research from my colleagues at the USC Library and Information Science program about libraries in the context of disasters and how librarians facilitate access to timely information in the context of natural disasters. And I want to just and I may ask my colleague Megan to say a little bit about this, but when we started this project, it really grew out of, in a way, kind of some of the innovations we were seeing in urban South Carolina, in Columbia and Richland County in particular. And Megan, do you want to say just something, maybe introduce yourself and say just quickly about this slide?
Yeah, sure. Hi, I'm Megan Rice at the Center for Rural and Primary Healthcare. And some of the first work we saw in libraries in South Carolina was at Richland Library around the Affordable Care Act, particularly with enrolling folks and providing accurate information about the Affordable Care Act and the health insurance exchanges at the time. And this photo was taken by the library social worker, Lee Patterson. I'm sure many of you know her, who came on board during this time working with the health insurance exchanges. And that was the waiting room, or waiting at the beginning of the day, the last day to enroll in the health insurance exchanges. And she, I believe, tweeted it out, and it was picked up by the Today Show. So, you know, when it pops up, that was the first image coming on. And fortunately, she was watching and able to get this photo. So I was involved in that project somewhat. And that was my personal introduction as a public health professional to the blindingly obvious role of libraries when someone hit me over the head with it, and the potential there. And then there's also work in rural South Carolina around Union County. And I think if you're talking about that, Noah, Blue Cross Blue Shield Foundation of South Carolina funded a pilot with a social work intern a few years ago. So the combination of those experiences really led to some of the developed work in South Carolina going on now. Thanks, Noah.
Yeah, thank you, Megan. And that's a perfect segue. So before I got involved with this project, I want to really highlight how Megan and her team at the South Carolina Center for Rural and Primary Healthcare, they really saw the need and they saw the opportunity. And they started with 5 libraries. And then more recently, and they actually, this is the photo of Quinn Megan Knox, one of the participants in these 5 funded projects from Lee County, South Carolina, where they developed the library community health hub, and Quinn presented last week actually at the South Carolina Public Health Association. Some of you may have been there, but I think there's just a growing interest both in the health and the library sector. We have, or I should say, the South Carolina Center for Rural and Primary Healthcare has expanded now to include 4 more library systems. And Megan and Alonti, do you want to briefly just introduce your work and kind of where it's going and where you're at currently with that?
Sorry, Awanti, please jump in. Yes, we were able to fund library systems in 2020 to that Noah already shared around a health liaison program within the libraries to be able to connect folks to healthcare and needed social services. And then through cooperation with DHEC, the expansion through some of the CDC health equity funds came in to be able to expand that to some other areas. And we just announced those 4 cohorts last week. And I will share a link to some of the information about the program in the chat.
Yeah, no, thanks, Megan. And I just want to highlight again. So again, I kind of work at the national level, and I can't emphasize enough how innovative this project is. There's really very few initiatives anywhere in the country that are really trying to work so closely with local libraries, particularly in rural America, and try to really build up success at the local level. So really want to thank Megan and her team for the opportunity to do this project. So I kind of joined the initiative last August of 2021, and based on kind of wanting to better understand, so where could this project go? What are the needs and opportunities across the state? So in partnership with Megan and her team, as well as Wendy and the State Library of South Carolina, we surveyed public library workers, including, I'm sure, some of you, about your health partnerships and needs related to community health. These respondents occupied a variety of roles within public libraries, so it wasn't just directors. We also tried to reach out to people on the front lines, youth services librarians, outreach librarians, people who work in libraries in a variety of capacities. And our goal was really to build up a more in-depth understanding of how South Carolina public librarians, what they need to better support health. And again, September 2021, there was a lot going on, and we recognized that kind of getting someone to fill out a survey in the middle of the pandemic was a bit of an uphill challenge, but we really want to thank those who did take the time to fill out the survey. We ended up with 123 complete responses and 19 partial responses from throughout the state. And I'm going to turn things over to my graduate research assistant, Joanna, to say a little bit more about the recruitment. Joanna, do you want to go ahead?
Yeah, so how we recruited everybody in order to maximize our survey distribution, we had several methods for contacting libraries. Emails originally were sent to a combination of public library listservs at the beginning of the survey, and that was that very first week when it went active. Then during the first week after that, about half week of the active survey, I sent emails to a lot of people through the Qualtrics email system, and it was 2 tranches. One was staff emails that I collected through government websites and public websites that had those emails for the staff. And then there was another one that was developed from department emails of libraries to try to get as many participants as we could throughout the staff. And then there was the weeks 2 and 3 of the active survey, we identified counties with low response rates. And those libraries were sent a combination of direct Facebook messages and then explaining the survey and providing the link within that message. And then I also did direct calls to directors or to the main library phones and encouraged participation of library staff with that. And all of this was done with the help of the state library, the South Carolina State Library and Wendy Copeland, who also contacted contacted people and encouraged them herself to when we had trouble reaching people. We didn't make any contacts in the 4th week. So this was from those 3 weeks of work.
Yeah, thanks, Joanna, and want to thank Joanna again. It's she briefly alluded. She she actually called library directors, especially as we're getting further on, to really try to boost in participation. So we want to thank everyone who took the time to fill out this survey. And so what did we learn? So I just want to go over some of our findings, starting with health services. Across the state, more than 60% said that their libraries supported access to COVID-19 related services, including 42% who offered immunization clinics for COVID-19 and 29% who offered testing services. But outside of the pandemic, beyond the pandemic, most hosted a wide variety of services that support health, with more than 40% respectively saying they had hosted everything from food drives to fitness classes, farmers markets, summer meals, health fairs, cooking classes, blood drives, and just a huge variety of different health services that are being offered in public libraries through partnerships across the state. And I just want to quickly highlight what some of the more common ones were. So we asked questions that asked what are services that library staff themselves were involved in offering, what services were partners, and unsurprisingly, when we asked about services that library staff themselves were offering, those tended to focus on access to information. We're information professionals. So across the state, more common health services and were things like locating and evaluating free health information online, subscription health databases, identifying and using online health resources, and understanding specific health topics. So those fundamentals of consumer health literacy. But we also looked at what are the more common services that are offered by partners. So these are things that partners are offering either by themselves or with the active participation of libraries. And here, some of the more common things were summer meals, blood drives, health fairs, again, immunization clinics, nutrition classes, and some basic health screenings. But whether it's offered by partners, by library workers, or some combination of the two, we found just a huge variety of different health services. And I just want to point out quickly, almost none of these were reported by more than 50% of respondents. So we both saw a huge variety of health services being offered across the state. And we also saw a lot of heterogeneity. In other words, what the health services that one library offered may have no correlation to the health services that another library may be offering. There's a lot of idiosyncrasy, a lot of noise in terms of what may be offered across the state. And I think this connects to one of the key challenges that we heard again and again, which is evaluation. Public librarians, we are not trained in public health evaluation. That is not part of our skill set. And we asked respondents, how, if at all, has your library evaluated the health outcomes? In general, people said health outcomes were not evaluated beyond monitoring participants. And I think this quote really speaks to this challenge. So one librarian said, we don't really have a way to track this info. We did weight loss programs, but the partner tracked progress and they didn't share the information. We have done nutrition and health programs with the hospital targeting diabetes and heart disease. We distributed food. We've had exercise programs for seniors, walking programs. They've done CPR training. So here's a library, like a lot of libraries, that are offering a lot of services that support health, but they have no real mechanism to understand the impacts. And I really want to emphasize again, this is one of the major challenges that we face. And I think we have to really wrap our heads around how do we tell the story of what's happening in libraries in ways that are going to drive long-term funding in a stable infrastructure. Just moving on, we also talked about what are some things that librarians really want. And I think first and foremost, librarians really want health workers. They really want people to come to their libraries and help them. And so just we asked if your library could have any health related professional, about how often do you think services would be needed. And over 90% of respondents said there was definitely a need for some health related professional at their library. The frequency of the need varied, but in general, people said, yes, there is a need for a health professional at our library. But interestingly, when we shifted to asking about specific types of health workers, the interest diminished a little bit. So social workers was probably the one that folks were either most interested in or already offering. But even with social workers, there was a substantial percentage, about a quarter of respondents, who said they were not interested. And so why would there be this difference between, on the one hand, over 90% saying we need outside help versus a little bit less interest in specific individuals like social workers or nurses, health educators, et cetera. And I think this quote really speaks to that disconnect. In an open-ended response, one librarian wrote, "We do not have enough staff and really cannot handle any more programs. Even when partnering with others, it takes staff time, and we just cannot do it anymore due to not enough staff." And I think that's really key. I think librarians, we do a lot in communities, and there's a lot of competing priorities, particularly among those who are directly working with the public. And I think this figure really shows some of the challenges that South Carolina's public libraries are dealing with, or trying to work across the state. Well over 50% of respondents say that people experiencing homelessness use their library as a day shelter, with 91% of urban libraries, 84% of suburban, 82% of town, and 59% of rural libraries saying that this occurred. And just especially in urban South Carolina, we see everything from drug overdoses, with almost 40% saying there's been a drug overdose at their library, violence that requires security staff or law enforcement, and only less than a quarter said that none of these things have occurred at their libraries. And I think this is important because it shows, on the one hand, that the most vulnerable are coming to libraries. The most in need tend to see the library as a space to access basic services, but it also shows the struggles that librarians confront, which can often lead to burnout, feeling overwhelmed, and feeling like you're alone and isolated, trying to solve all of society's problems, which is of course not an outcome that we want. And so how can we change that? And just I want to, I know there's just, as some of you know, there's just an extreme interest in telehealth right now. But I want to just say something briefly about telehealth versus health liaisons. So focusing specifically on telehealth, a greater proportion of librarians said they were not interested than interested. And the difference is not huge. In the survey, 35% said they were interested in telehealth. 40% said they were.
Real boring webinars require training,
40% said they were, and 25% saying they were already supporting telehealth. And there was a greater interest in bringing in a health worker or liaison. So I think the difference between social work interest and telehealth interest shows that librarians really want, they want warm bodies. They don't necessarily want to just have like a telehealth kiosk that's expected to kind of just run itself. They're really looking for relationships. And so what is the current state of relationships between our public library workforce and our health workforce? Yeah, thanks. Let me see if I can, sorry about that. Give me 1 second. Okay, yeah. And so just for folks now, I just thanks someone let me know that I can mute all, so hopefully that'll solve some of the audio problems we've been experiencing. Apologies for that. But looking at relationships, more than 50% reported close or somewhat close relationships. with folks in the education sector, nonprofits, Parks and Rec. But across the board, less than 50% reported close or somewhat close relationships with any organization in the health sector. So this is really an opportunity to build those relationships. And this figure, which is just an abbreviated version of what we found, for instance, across the state, almost 90% of public librarians report having very close or somewhat close relationships with K-12 schools. But when we drop down to health sector organizations, relationships are much weaker, with the health department being the most common relationship, but then dropping down to only 29% of respondents that they had a very close or somewhat close relationship with WIC clinics, for instance. And another way we asked about kind of the strength of relationships between libraries and the health sector was asking about who had librarians worked with on either programmatic or funded initiatives designed to support health. And interestingly, we actually found that the most reported health partner is the South Carolina State Library. And I think that's interesting and telling, because I think up to now, public librarians are not necessarily looking to the health sector. By and large, across the state, we have our own kind of continuing education and professional development infrastructure supported by the South Carolina State Library and also the Institute of Museum and Library Services, IMLS, the national analog of the state library. And so, but there's also, this is kind of a glass half full, glass half empty type figure, because on the one hand, we're not seeing a lot of respondents report working directly with organizations in the health sector on larger initiatives. But on the other hand, we are seeing some that are. So we are seeing some organizations working with everything from the National Network of the Library of Medicine, regional healthcare systems, health foundations, et cetera. And I'll come back to the importance of that in just a few slides. But for now, I just want to highlight briefly some of the rural-urban differences that we saw. Rural librarians were in general those least likely to have formal health partnerships, which tended to be most common in urban South Carolina. So, and among our rural respondents, 50% reported no partners in programmatic or funded health initiatives. So the more rural the respondent, the less likely they are to have participation in these health networks. But on the other hand, rural librarians were those most interested in support, and they're looking for opportunities. So just to give one example, most rural librarians reported being interested in offering mental health first aid trainings at their libraries. And most urban respondents said that their libraries had already offered these trainings. Just transitioning to needs and opportunities, only 10% reported no barriers to supporting health. So almost every single respondent said that there were things that they were grappling with as they tried to support health. Almost 1/3 of respondents said that their library had someone they considered to be a health champion, someone who works at a library who's passionate about health, who wants to champion it. So I think there's people in the health sector that we can really reach out to. Most respondents think that individuals in their communities look to the library as a safe and trusted space, including to potentially access both health literacy and health services. Most see health equity as a priority for their libraries. And only 10% of respondents said that one of those barriers is that health is not perceived to be within the mission of the public library. Or in other words, almost all respondents said that health is perceived to be part of what public librarians do. So given this, where do people want to go? Where are folks seeing our kind of top priorities in terms of doing more to support health? And I think there's some interesting differences if we look across the state. As I said earlier, urban libraries have been doing this for a minute. And so in urban libraries, the top priority is sustainability. How do we sustain the health initiatives we've already gotten going? How do we evaluate them? Whereas outside of urban South Carolina, Carolina, things look quite different. Outside of urban South Carolina, the top priority is how do we get started? We'd like to do something. We see this as a priority. How do we get started? How do we partner? And others are also concerns, but how to get started and how to partner were top priorities outside of urban South Carolina. And barriers were also different between urban and non-urban parts of the state. In urban, related to sustainability, the top barrier is funding. So there's more going on than urban South Carolina public libraries can sustain. And so funding outside of urban South Carolina, some of the top barriers are lack of expertise or perceived lack of expertise, not sure where to start, a perceived lack of partners, and also a perceived funding. So we saw some different barriers and priorities looking at different parts of the state. And so just based on the survey, and we're getting close to the discussion now, so I'm really excited to kind of turn things over to you all in a minute to hear your thoughts. But just based on what we learned in this survey, as well as some of the priorities of the South Carolina Center for Rural and Primary Healthcare, we're developing this theory of change model. And what we're really interested in is how do we support and grow the number of librarians who consider themselves to be health champions, who are interested in health, who are curious about it, and really see their libraries as kind of champions of health. And that doesn't happen when librarians are isolated. It happens when librarians are connected with folks in the health sector, when they're connected to health partners, when they have infrastructure and support around them, opportunities for peer-to-peer mentors to exchange with others within the public library workforce, opportunities to connect and work with community health workers and social workers, and opportunities to really build and participate in local health coalitions. And we've just flagged a few opportunities for training around this topic. But we also, and I don't have time to go into it, but we found some important differences in terms of library directors versus frontline staff. So I think the needs for library directors are slightly different. When we're looking at an administrative level, I think there's a real need for library directors to be seen as local health leaders. We saw library directors were interested in working with local health leaders, getting involved in kind of health policy planning, and also hearing from how other library leaders are kind of weaving health into the administration of the library. Library administrators are looking for best practices and how to weave this in without overburdening staff, without contributing to staff burnout, and how do we fund and sustain this type of work. And so that's really, I know this has been a whirlwind for the last 42 minutes, but we have plenty of time in the grand scheme of things, 18 minutes. And I'm really excited now to hear from you all. What are your questions? Where should we go from here? What has been your experience talking about health and public librarianship? And to facilitate this dialogue, I'm actually going to stop sharing my screen for a minute. And I don't know if folks can unmute themselves since I muted everyone, but feel free to put your questions or thoughts in the chat, or just turn on your mic. If you have an idea that you'd like to do, we can do some collective brainstorming. I'm really hoping this will be a great opportunity for dialogue and networking. So yeah, how is this information resonating with you, and what are what's your thoughts? Yeah, looking forward to hearing from you.
Hey, Noah, this is Noreen O'Donnell. How are you?
Hello, good. How are you?
I'm good. So I won't be shy. Everyone else is feeling a little shy, so I'll jump in. But, you know, I don't know that I have anything earth-shattering to share here, but I did want to say that, so first of all, for those on the call that I don't know, I'm the program director for Diabetes Free South Carolina, which is as I put in the chat, an initiative of Blue Cross Blue Shield of South Carolina in collaboration with the Blue Cross Blue Shield of South Carolina Foundation. And as you can tell from our name, we have a very specific focus on diabetes. And that is fairly broad, though. We really focus on preventing diabetes and its complications. So kind of the whole spectrum. But really just wanted to say that I'm very enthusiastic about the work that you all have done, the work that Megan and her team are engaging in. And we definitely have an interest in perhaps pursuing a model where we can do some sort of work like the work you're describing, using libraries as community health hubs with a specific focus on diabetes. We haven't defined what the model might be. We haven't really gotten down into any level of detail other than to know that this is an interest of ours, and we're certainly going to be reaching out to partners in the coming months to see what this might look like, again, from that diabetes perspective, knowing that, you know, working with patrons of the library, you wouldn't want to pigeonhole people, and but I think that we can also understand that in South Carolina, we can all benefit from diabetes related prevention messaging or whatever that might look like. Anyhow, I guess I'm sort of rambling on now, but just to express, you know, our interest from a program level, and thank you all for the groundwork that you're laying in South Carolina for this work.
Yeah, thank you, Noreen, for speaking up. And I see Reagan, if I'm pronouncing your name left, is clapping her hands. So I want to first thank, and I'm going to share my screen. So I may do a little bit of jumping between sharing and not sharing, but I really want to highlight and emphasize, and I think this is really key for anything, whether it's diabetes prevention or telehealth, that things are happening across the state. And I want to, so if you go to the South Carolina State SNAP Ed page, all three of these initiatives have actually involved libraries as key partners: SC Plant the Seed, Food Share SC, and obviously the last one is all focused on libraries. So there's enormous infrastructure already in place around food access and food literacy, including this project of the South Carolina State Library with funding from the National Network of Libraries of Medicine called Read, Eat, Grow, which encourages nutrition education, health literacy, and this is not anything kind of to say negatively, but I think for anyone in the health sector, regardless of what you're trying to do, I really think fundamentally the very first thing to do is to educate yourself on what librarians are up to, because in my experience it tends to be much broader than what you may initially think. And then after you've done that legwork, then see how can we get involved in what's already happening, and maybe extend that, maybe broaden that, maybe bring our unique expertise to augment kind of what already is. But I'd love others to kind of chime in, especially if you participated in the Read, Eat, Grow or some of the SNAP Ed programs. But yeah, yeah, and Megan says for her, one of the biggest lessons has been that libraries are doing health work, even if it isn't defined as such. And I agree. I think even when it comes to social work, oftentimes even the library social work programs are not always explicitly labeled as health. So I think even that social work in the library is not always seen as kind of part of health promotion. Rebecca, yeah, go ahead. Thanks, Rebecca.
Hi, I wanted to introduce myself. I'm Rebecca Jacobson. I'm the Executive Director of Smoke Free SC. And we're a very small nonprofit. We're just 3 people. We just added a staff position who started this week as a community engagement coordinator. And one of the things that I think is a really interesting opportunity is for us to get smoking cessation resources into your libraries, particularly in vulnerable communities, because we know those are places where there are high rates of adult smoking. And we know that smoking is directly related to heart disease and diabetes and all of these other high prevalence chronic conditions that we know that everybody's working on. So my new community engagement coordinator was not actually able to attend this today, but I just wanted to introduce myself so that you all can jot it down as a potential relationship. Tara Bell is located in Spartanburg, and right now she's just going to be doing a lot of training and onboarding. But in the next few months, we want to get her out and connected to places and communities that might be interested in promoting smoking cessation. So I just wanted to introduce myself. My email address is rebecca@smokefreesc.org, and I can throw that in the chat box too. So as you all keep moving down this avenue, please keep smoking cessation in mind.
Yeah, thanks, Rebecca. And yeah, absolutely. If folks want to drop any emails in the chat, please do this. Like I said at the beginning, this is a great opportunity for networking as well. Yolanda, go ahead.
Hi, I'm Yolanda Anderson with South Carolina DHEC. Well, soon my name will change to Patterson because I recently got married. But I am the community clinic coordinator and the interim clinic community coordinator for SCDHEC. We're wanting to reach out to the underserved community and provide county health department services to them. So it could be a number of things. Anything that the county health department offers, we want to be able to offer that to the underserved community. So we're wanting to partner with the libraries, the local libraries in the upstate region, so that we can bring our mobile unit out and serve those in that community.
Yeah, thank you so much, Yolanda. And I know Megan, one of the new cohort members is Oconee in the upstate. And so I think there's going to be some great opportunities in the upstate region in particular to really build things out. Megan, I don't know if you want to say anything about that.
Sure. Particularly in the upstate, Oconee, Abbeville, and Union are already programs officially part of the program that we have. I think we've had some conversations with some other areas. Happy to help connect you to any of those programs. Alanti, I don't know if you have anything to add. I don't need to be the only voice here from the center.
I would just add, because I got this question before also, one of the ways that we were able to do our outreach to the library was through the state library, through Wendy. And so if you are looking to get into libraries, we're happy to connect you to the ones that we know, that we work with, that are part of our cohort, but also you may want to reach out to the state library because of course they have a more expansive list than we do.
Yes, absolutely. The state library has been an incredible partner with all of this, not only in helping to educate us in terms of working with libraries. Those of us on the call from the public health side, we're all about collaboration and community engagement and knowing who we're working with. But Wendy and Noah himself too have been critical in saying, no, you don't want to put this that way, or you might want to reach out in these ways, or being able to have those connections, because just as we know from our public health side, sometimes it's who does the introduction and who's letting you know. And they've been amazing partners and letting us know when we're off base and maybe what we're asking in an RFP or in terms of expectations are not really realistic, so we could adjust. But also on the other side, being able to say, hey, these people mean what they say. They're going on. It's an opportunity if you'd like to take advantage of it. So it's been an excellent partnership. And I am sorry that Wendy was not able to join us today so that she could be hearing this in real time.
Okay, thank you. So you said Abbeville, Oconee, and where else?
Union for the upstate region.
For the upstate region.
Yes.
Okay. Yeah, and the mobile bus, it'll probably take up like 5 to 7 parking spaces. So the terrain is very important too, that it's flat, so that we could park and be able to set up. So I will reach out to the state library. Thank you for that resource.
Mm-hmm. And Alanti and I would be happy to introduce you to the do a warm introduction to the health liaisons at those particular libraries that we're working with.
Yes, ma'am. Thank you.
Yeah, thank you, Yolanda. And I see Ruth put a link in the chat to some of the opportunities available through the National Network of the Libraries of Medicine and their regional campus based out of the Medical University of South Carolina. But yeah, and Ruth, I don't know if you can or are interested in unmuting yourself, but I just want to highlight, so some of you may know, historically our here in South Carolina, the NNLM that we were part of was based out of Baltimore, Maryland, which was not the most accessible. But now there's actually a National Library of Medicine kind of outreach network location here in South Carolina. So there's really, I think, more than ever before, there's lots of opportunities. Ruth, do you want to say a little bit more about that?
Well, I'm not sure if anybody from the RML is on this call or not. If so, they need to speak up and speak instead of me. But yeah, Shannon Jones is the library director down at MUSC Library, and I'm at University of South Carolina School of Medicine Library in Columbia. So we're kind of the two academic health sciences libraries in the state, and we have a really good working relationship with them. But yeah, they just won the contract for National Network of Libraries of Medicine recently, so they're still, I think, building their infrastructure a little bit over in Charleston, but they have a lot of money out there, for outreach efforts, and so that's why I put that link in there, just so you could see the various ways they have. And as I was listening to all the talk here, I was thinking, wow, it would be really interesting. There's so much great work going with South Carolina Center for Rural and Primary Healthcare, and the funding opportunities you're providing, and it's, you don't want to duplicate efforts, but it would be interesting at some point if there was some pooled money, between two large groups like yourselves, to do something for one library or a group of libraries or something, I don't know. I guess I was just thinking sort of macro scale thinking, for the state of South Carolina or something. And, maybe some brainstorming between those two big partners at some point or something. And be glad to host that here at my library in Columbia or anywhere, or in Charleston. We really need to go to Charleston, I think, for that kind of brainstorming.
Yeah.
Don't need to do it in Columbia.
I agree. Charleston is a fabulous environment.
Yeah, much better for brainstorming to be in Charleston near the salt of the sea air, and the good food in Charleston. So, but it's just something to keep in mind there. But that slide you had, Noah, that showed all the different partners, in the state of South Carolina and nationally that are involved. I mean, there's really a lot of people that are working in this area. So good for you on doing research on, I love the research you've done on the needs of listening to the public libraries about what they need. So critical, so really exciting, and Roswell Mcconaughey is here at our library, and she's our assistant director for education and outreach. And she is a consultant with Megan Wise in the Center for.
Oh, I think you may have muted yourself, Ruth.
Sorry, yeah, she's on top of all this stuff, so I rely on her, but we're starting to think about strategic planning, and our efforts, in the next couple of years. And this might be an area for us we're just thinking about it. We're not ready to jump in yet, but it's just, it's a very exciting time for public libraries. To me, it's like, public libraries are where it's at, academic libraries are, we're good, but we're mostly about educating medical students and other healthcare professional students, but public libraries are frontline, it's really exciting what public libraries are doing. So good for you all.
Yeah, thanks, Ruth. And I want to just make a quick shout out, Monique Hill in particular, who's been around South Carolina for a minute and is now working for the regional library, but she had been one of the leads on Hands-on Health SC, which you saw came up, and a lot of rural libraries. This is a collaboration with the state library. It's not as active as it used to be, but it's a great example of kind of that tapestry, one of the other networks that has involved libraries, rural libraries in particular, as health partners. And I completely agree, Ruth. I think I'm a big believer in the power of conversation, and the more we get the right people in the room, the more we're able to figure out how we can pool our resources and really have the big impact that we know we need on public health. So it's not just one initiative, but it's really pooled initiatives. And I see we're getting close on time, so I want to make sure we can. I'm going to jump back, but I want to just say, so before we run out of time, so we are finishing our report, and that report is going to be available open access. I have the registration link, so I'll make sure everyone who registered will get a copy of the report. But you can also email me with any project updates. I really loved what Ruth said about continuing the conversation. So please do. I don't necessarily have to be kind of the organizer of that. I'd love to be a participant, but I think kind of yeah, I think great things happen when people are talking to each other. And that's really in my experience, the only way to really make change. And so I want to thank again the South Carolina State Library, Joanna Roberts, the graduate research student assistant, UNC Greensboro, and the South Carolina Center for Rural and Primary Healthcare. I want to thank the over 140 public librarians who took time out of their very busy days to fill out the survey. And I want to thank all of you for coming here today and engaging in this conversation. And so we're getting close to noon. We do have a couple minutes if folks had things they wanted to ask or bring up. But otherwise, we can go ahead and wrap things up for today. I'll leave the Zoom open if folks want to continue the conversation, but I'm going to go ahead and just turn off the recorder.